In my practice, I see a lot of GI conditions and gut symptoms. One of the most common symptoms that goes along with a lot of these symptoms is fatigue. Fatigue is something that resonates with a lot of people, and a lot of people, you recognize that they have abnormal low energy. In terms of what causes fatigue, that list is extremely long. Maybe you don't test all of it, but just try to get more information to try to get a better grasp of what might be driving their fatigue. Like, for example, when did this all start? Right? Well, it all started after I got, mono. Okay, a virus came in, disrupted the immune system, right? And then ever since then, we've had this fatigue. Well, the fatigue just, slowly, gradually crept up on me. Like nutritional deficiencies, for example, they can slowly be acquired over time, right? A little depletion, little depletion, little depletion. All of a sudden, maybe we have B vitamin deficiencies or B12, folate, carnitine, CoQ10, right? Like these things that can kind of drive the energy pathways. Make sure that there's no anemia present, right? Anemia means we have low hemoglobin, low hematocrit, or low red blood cells. These are red blood cell markers. And why is that important? Because red blood cells carry our oxygen throughout our body and our bloodstream to deliver it to all of our tissues and organs and cells, right? So we need oxygen, and that's priority number one. If we have anemia, we have to address anemia because it's really tough to get better with anything if we have anemia. Anemia is always at the top of the list that we want to rule out with a simple CBC or hemogram. We want to make sure that we look at that and make sure that we do not have anemia present. So we can test for nutritional deficiencies inside the cell called intracellular nutritional deficiencies as well. Because remember, that is where our mitochondria live, and they are the powerhouse of the cell that makes ATP, which is cellular energy, right? So we want to make sure that we get good idea of what our nutritional status is inside the cell. Other things like thyroid, for example, a very common symptom of hypothyroidism is fatigue. If you're fatigued, it does not mean you have hypothyroid, but we like to look at a thorough thyroid panel to make sure that we have good T4 levels, good T3, which is our active thyroid hormone, and making sure that that's not contributing to energy crashes. How about people that have fluctuating energy throughout the day? I hit snooze 5 times, can hardly get out of bed. Once I get going, I feel really good, or maybe I feel really good in the morning, I have a lot of energy, and then I eat lunch and I crash. Or maybe like 3, 4 in the afternoon, like I just hit a wall. I do pretty well up until then, maybe not great, but better, and then I hit a wall at 3 or 4, right? So what stuff can fluctuate throughout the day? Well, cortisol, right? That's our stress hormone. Cortisol should be highest in the morning so we can get through our daily activities and feel good, in the morning time. And then it slowly dips throughout the day and then plateaus at a low level in the evening so we can fall asleep. So cortisol is something that fluctuates throughout the day. So when we have fluctuating symptoms of maybe super low energy in the morning or really good energy in the morning, or I feel I'm a night owl, or I get a second wind, or I crash in the afternoon, cortisol is something that we measure a lot to understand are the adrenal glands making appropriate amount of cortisol at the appropriate times. So we can map these things through urine or saliva typically is the best way to do it. Blood sugar is another one. And the adrenals and the blood sugar responses, they feed off of each other. So if we have hypoglycemia or reactive hypoglycemia, which means kind of like the hangry, you hear hangry talk all the time, like I get hangry and then I eat and I feel better, right? Or I'm not as irritable. Or maybe I have a headache, or I have low energy, or I'm jittery, or I'm shaky. And then I eat and it goes away, or I have brain fog. And I eat and it gets better, right? Then we're thinking, okay, do we have any kind of hypoglycemic episodes, reactive hypoglycemia? It's kind of like a roller coaster. You eat and it comes up and then it crashes, right? And then you got to eat again every 2, 3, 4 hours to function. So those kind of things are things that we look at, and we test things like blood sugar and insulin and hemoglobin A1C and triglycerides in a lipid panel, fasting glucose. Sometimes LDH is helpful. There's a lot of different things that we can look at to try to understand what the mechanism of fatigue is, right? So those are some of the common ones that I see. So chronic viruses, obviously those can be causing fatigue as well. I mean, toxin exposure. I mean, there's a lot of different things that we go through, and your food sensitivities. Sure, you could argue that maybe those caused because of the inflammatory effects of food. After I eat, I get tired, or maybe it's an insulin resistant pattern. I eat, and my blood sugar can't get inside the cells, so my body has to produce a tremendous amounts of insulin and turn these simple sugars into triglycerides, and that takes up a lot of ATP, and then I get tired. Or you can have fatigue from SIBO or candida or an autoimmune condition. I mean, it varies all across the board, and that's why we need to test and not guess and try to figure out what's driving the fatigue. I see it, flat out exhaustion all the time too, right? Could it be coming from like low cortisol, where the adrenals are just, they've had enough, they're tired, they're fatigued. The adrenal fatigue is not really a term, but it's called HPA axis dysfunction, which means your hypothalamus in your brain, it receives all the stress, right? Remember, stress is not just anxiety and depression and a job that stresses us out. It can be things like low blood sugar over time. It can be things like pain, infection, illness, trauma, anything like that. But the stress is received on the hypothalamus of the brain. That relays information to the pituitary gland, and the pituitary gland then tells the adrenal glands what to do. Release cortisol under stress. When that happens over time, chronically, sometimes that whole system, the communication just gets weaker and weaker and weaker. And now it's not telling the adrenals to make enough cortisol over time. And now we can have really low cortisol as well, which can give us complete exhaustion. So we want to make sure that we test and don't guess. I don't know what's causing a patient's fatigue until I test and get further information. And then hopefully with the testing that we've done, we have a much better idea and more laser focus as to what's causing their fatigue. When we look at fatigue, we want to look at food, microbiome imbalance. Is there any toxic exposure? Do we have any infections, and like in terms of history, like a chronic virus, for example? Do we have nutritional deficiencies? Is stress impacting it, or cortisol function and coming out of the adrenals? Do we have anemia? Is blood sugar stable? We want to look at a lot of different variables to make sure that we understand why someone is tired or fatigued.